In this video, we will explore scientific data on the medicinal properties of rosemary and how it can help in the treatment of various diseases, including serious ones such as neurodegenerative disorders, cardiovascular diseases, inflammatory processes in the body, type 2 diabetes, liver diseases, digestive disorders, skin conditions, and hormonal imbalance. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Rosemary is an aromatic plant that belongs to the mint family. It has been used since the times of ancient Rome, particularly for centuries, as a remedy for headaches, to improve memory and concentration, and to relieve gas and constipation. In recent years, its popularity has grown significantly as research has confirmed many of its medicinal properties. Rosemary is known for its fresh, herbal scent and its rich, woody aroma. Its needle-like leaves and oil are the most commonly used parts, widely applied in both cooking and medicine. Despite its many culinary uses, rosemary has always been highly valued for its healing properties. But what are its most well-known and traditional medicinal applications? The numerous health benefits of rosemary stem from its unique active compounds. It contains powerful anti-inflammatory components that give it its distinctive taste and aroma. Additionally, rosemary is rich in phenolic compounds, which are plant-based substances with strong antioxidant and antimicrobial properties. Now, let's explore 10 compelling reasons to drink rosemary tea every day. Reason 1, helps regulate blood sugar levels. Rosemary is especially beneficial for people with prediabetes or type 2 diabetes. But why does it have such a positive effect on blood glucose levels? Rosemary enhances insulin sensitivity, allowing this hormone, which is produced by the pancreas, to function more efficiently. Specifically, it helps muscle cells absorb sugar, glucose, from the bloodstream more effectively. Additionally, rosemary contains certain compounds that act similarly to insulin, further increasing its effectiveness in regulating blood sugar levels. Reason 2, improves blood circulation. Rosemary helps widen blood vessels, which can contribute to lowering blood pressure. As is well known, high blood pressure increases the risk of cardiovascular and cerebrovascular complications. Expanding blood vessels not only helps regulate blood pressure, but also improves microcirculation. Smaller blood vessels and capillaries can deliver oxygen more efficiently to tissues and aid in the removal of metabolic waste products. The anti-inflammatory and antioxidant properties of rosemary further reduce the risk of blood clot formation. However, it is important to keep in mind that excessive consumption of rosemary tea or other forms of rosemary may lead to side effects, which we will discuss later. If you have any medical conditions, especially multiple chronic illnesses, or if you are taking medications, it is essential to consult a doctor before using rosemary as a supplement. The same applies to other herbs, dietary supplements, and medicinal plants. Harshar, reason 3, eases digestive issues. Rosemary is well known for its ability to support gut health. Traditionally, it has been used to treat various digestive problems, including reducing gas and bloating, promoting regular bowel movements, and relieving stomach pain, cramps, and discomfort. Due to its antispasmodic properties, rosemary helps relax the smooth muscles of the digestive tract, which can reduce discomfort and improve digestion. In particular, rosemary stimulates the gallbladder to produce bile, aiding in the breakdown of fats and optimizing the digestive process. Additionally, its anti-inflammatory properties make it especially beneficial for people suffering from irritable bowel syndrome. It may also help with inflammatory bowel diseases such as Crohn's disease and ulcerative colitis. Rosemary plays a key role in maintaining a balanced gut microbiota, which consists of beneficial bacteria, essential for overall health. Its prebiotic properties nourish these good bacteria, creating an environment that supports digestive well-being. Beyond that, rosemary's antimicrobial properties help inhibit the growth of harmful bacteria and fungi, further contributing to gut health. Reason 4, enhances brain function. Rosemary has been gaining increasing attention from scientists due to its potential benefits for brain health. One of its key components, carnosic acid, has the ability to protect the brain from damage caused by free radicals. Additionally, rosemary helps break down a chemical in the brain known as acetylcholine, which improves communication between nerve cells. This in turn enhances memory and concentration. Its benefits extend beyond cognitive function. Rosemary is also known for its positive impact on mood, helping to reduce anxiety and fatigue. Many of these effects have been confirmed by scientific studies. Interestingly, as early as 500 BCE, students in ancient Greece used rosemary to improve memory and focus. Some of rosemary's brain-boosting effects may be linked to its ability to improve circulation, as mentioned earlier. Increased blood flow to the brain can lower the risk of tissue damage after a stroke, whether it is caused by a hemorrhage or a blocked blood vessel. The antioxidant and anti-inflammatory properties of rosemary provide neuroprotective benefits, which are especially important for preventing neurodegenerative diseases, including Alzheimer's disease, other forms of dementia, and even Parkinson's disease. Reason 5. Has powerful anti-inflammatory properties. Rosemary has strong anti-inflammatory effects, making it an excellent natural remedy for people experiencing joint pain associated with inflammation, such as arthritis, osteoarthritis, or muscle pain. These benefits can be obtained both by regularly consuming rosemary as part of a diet and by drinking rosemary tea. Additionally, research suggests that applying rosemary essential oil directly to affected areas can significantly reduce pain. Reason 6. Helps manage stress. Drinking a cup of rosemary tea each day can be especially beneficial during periods of high stress or anxiety. Additionally, rosemary supports better sleep quality, helping to relieve insomnia caused by stress. Reason 7. Strengthens the immune system. Rosemary helps strengthen the immune system, making the body more resistant to infections. Its antimicrobial properties, combined with its antioxidant and anti-inflammatory effects, help suppress the growth of viruses, bacteria, and fungi. Historically, these properties made rosemary a popular natural preservative used to extend the shelf life of food. Reason 8. Supports liver detoxification and fat metabolism. Rosemary is beneficial for liver health as it helps reduce fat accumulation in this vital organ. It is not only useful for individuals with fatty liver disease, but also helps protect liver cells from damage and inflammation caused by medications or toxic substances. If you have liver issues, incorporating rosemary into your diet, whether as a seasoning or as rosemary tea, may be worth considering. However, it is important to consult with your doctor before making any changes. Reason 9. Improves skin and hair health. Rosemary offers numerous benefits for the health of both skin and hair. It helps combat premature aging, accelerates wound healing, and alleviates conditions such as seborrheic dermatitis, acne, psoriasis, and alopecia, which is associated with hair loss. Its effectiveness in these areas is supported by scientific research. Reason 10. Beneficial for eye health. Rosemary shows potential in supporting eye health, particularly in combating age-related changes. It has the ability to slow down the progression of cataracts, which is the clouding of the eye's lens, and age-related macular degeneration, a condition affecting the back of the eye that can lead to vision loss. Studies have shown that the compounds found in rosemary not only reduce the risk of developing these age-related conditions, but also help slow their progression. What is the secret behind rosemary's health benefits? The health benefits of rosemary can be explained by the presence of polyphenols, such as carnosol, rosmarinic acid, and caffeic acid. These compounds have powerful antioxidant, anti-inflammatory, and antimicrobial properties. Additionally, rosemary contains flavonoids like apigenin and luteolin, which interact with other biologically active substances. It is important to note that although many studies have been conducted in laboratory settings using cell cultures and animals, many of rosemary's healing properties are gradually being confirmed through clinical research involving humans. How can rosemary be used? Infusion. Similar to tea, this is one of the most popular ways to use rosemary. The leaves of rosemary are steeped in hot water, resulting in a drink commonly referred to as rosemary tea. Decoction. A decoction differs from an infusion in that the rosemary is boiled in water, typically using the harder parts of the plant, such as the stems. This method allows for the extraction of deeper flavor notes and biologically active compounds. Culinary use. Beyond beverages, rosemary is a favorite ingredient in cooking. It can be found in markets in both powdered form and as various extracts. Rosemary also acts as a protective agent against toxins that can form in food, especially when cooking meat at high temperatures, such as when grilling, barbecuing, or baking. These cooking methods can produce harmful compounds called heterocyclic amines, which have been linked to the development of certain types of cancer, including colon, breast, and prostate cancer. Studies have shown that marinating meat with seasonings containing rosemary before cooking can reduce the level of these toxic compounds by up to 90%. While the main strategy should be to consume overcooked meat or fish in moderation, adding rosemary during cooking is also a beneficial measure. Supplements and capsules. For those needing a more concentrated form of rosemary, supplements or capsules are available. These often contain rosemary powder, allowing individuals to access its beneficial properties without the need for preparation. Tinctures and external use. Rosemary tincture is a liquid extract, commonly mixed with alcohol. When taken internally, it provides a concentrated dose of rosemary's health benefits. Rosemary essential oil, when diluted in a carrier oil, can be applied directly to the skin. This method offers numerous benefits and is often found in cosmetic products, including ointments, creams, aromatherapy, and perfumes. Rosemary has secured a strong place in aromatherapy, helping to relieve stress and promote relaxation. Its aromatic essence is highly valued by many people. Rosemary is used for air diffusion, added to baths, or applied during massages. One simple way to use rosemary is by placing a few sprigs in water, which creates a natural air freshener, filling the space with a pleasant fragrance. Additionally, rosemary has found its place in gardening, where it is used for decorative purposes and as a natural disinfectant. How to make rosemary tea? Fragrant rosemary tea is more than just a drink. It's a true ritual that fills the home with warmth and comfort while also energizing the body. Its herbal, slightly piney aroma wraps around you like a soft blanket, and its sharp taste awakens both the mind and senses. Ingredients needed: 1 to 2 teaspoons of fresh or dried rosemary leaves, 240 to 250 milliliters of boiling water. The aromatic steam will enhance the flavor. Natural sweeteners if desired: fragrant honey, caramelized maple syrup, or mild cane sugar. Preparation process. Start by selecting your ingredients. If you're using fresh rosemary, be sure to wash it thoroughly under cool water, letting the droplets run down the emerald green leaves. Next, bring the water to a boil in a small saucepan over medium heat. Once the water begins to bubble eagerly, reduce the heat to the lowest setting. Now it's time to brew the tea. Gently place the rosemary leaves in your cup and pour the boiling water over them. Immediately, the delightful aroma will fill the air. Let the drink steep for 2 to 3 minutes, allowing the herbal notes to fully unfold. Now decide how you'd like your tea: rich and slightly tangy, or light and clear. If you prefer a clear, clean liquid, strain the infusion. But if you enjoy a deeper flavor, leave the leaves in the cup. This tea can be enjoyed hot, with its warming waves of aroma, or chilled, where it offers a refreshing boost. Tip: try the tea without any sweeteners to experience its full flavor profile. Natural rosemary has a complex, balanced bouquet that doesn't need any additional notes. However, if you wish to add a bit of sweetness, honey will beautifully complement its refined tang. Take the cup in your hands, inhale the piney herbal scent, and allow the rosemary tea to fill you with the power of nature. Preparing rosemary tea using the decoction method. The ingredients and preparation process are the same as in the previous method. Serving. Once the tea is ready, strain the liquid. The decoction can be enjoyed either hot or cold, depending on your preference. Some people enhance the flavor by adding a bit of honey or a few drops of lemon juice. Note: a decoction typically has a more robust flavor than an infusion. It is believed that the decoction method helps to extract the beneficial compounds and nutrients from the plant more effectively. Choosing between the two methods generally depends on personal taste preferences. What side effects and risks are associated with rosemary? Rosemary is not only a fragrant herb with a strong aroma, but also a natural remedy with numerous health benefits. However, like any plant, it requires mindful and responsible use. In some cases, rosemary may cause unpleasant reactions, especially if precautions are not taken. The aromatic, essential oil-rich rosemary can be a tricky ally for those whose bodies are sensitive to plant compounds. An allergic reaction may occur not only when consuming it, but also when it comes into contact with the skin. Sometimes, after drinking a cup of rosemary tea or eating a dish generously seasoned with this herb, a person may suddenly notice itching, redness, or irritation. In some cases, the skin may react more intensely, causing discomfort and a burning sensation. People with skin conditions need to be particularly cautious. Any essential oil or infusion containing rosemary can trigger irritation if the skin is already inflamed. For this reason, it is best to consult a dermatologist before using it. Additionally, applying rosemary to open wounds or burns is strictly prohibited. It will only intensify the pain and may slow down the healing process. How does rosemary affect digestion? Rosemary tea is warming and invigorating, but if consumed in excess, the results might not be as pleasant. When a person drinks more than 2 cups of rosemary infusion per day, their stomach may react unexpectedly. Initially, they might feel a heaviness, as if a balloon is expanding in their stomach. Gradually, this discomfort may be accompanied by cramps and unpleasant rumbling, turning mild unease into real pain. Some people experience nausea, which can even take the enjoyment out of their favorite foods. In the most uncomfortable cases, the body might try to get rid of the excess rosemary by inducing vomiting. This is a clear warning signal. The body is indicating that it is not fond of such a large amount of the spicy infusion. To avoid such outcomes, it's important to consume rosemary in moderation. This is especially crucial for those who are just starting to incorporate rosemary into their routine. Beginning with a small amount allows one to gradually assess how the body responds. If unpleasant sensations occur after consumption, it's best to stop right away and, if needed, consult a doctor. Rosemary is a gift from nature, but even beneficial herbs require a respectful and mindful approach. Who should avoid rosemary? People with symptomatic gallstones. Rosemary actively stimulates bile production, aiding digestion, but for those who already have gallstones, this property could lead to serious complications. The increased bile flow may cause the stones to move, which could result in painful attacks or even blockages of the bile ducts. If someone has been diagnosed with gallstones and they are showing symptoms, it's better to avoid consuming rosemary to prevent putting the body at risk. People with blood coagulation disorders. Rosemary contains substances that have a mild anticoagulant effect, which can thin the blood. For a healthy person, this is not a significant concern, but for those prone to bleeding or with blood coagulation disorders, consuming rosemary could increase the risk of unexpected bleeding. This is especially important for those already taking medications that affect blood clotting. In such cases, it's essential to consult a doctor before adding rosemary to the diet. Pregnant and breastfeeding women. Rosemary is a powerful herb, and its effects on pregnant and breastfeeding women are not fully understood. There is not enough scientific data to determine how safe it is to consume during pregnancy or while nursing. For this reason, doctors generally advise against using rosemary during pregnancy and breastfeeding to avoid any potential risks. While rosemary offers benefits to many, its use should be cautious and well considered. If there are any doubts, it is best to consult a healthcare professional in advance to avoid unnecessary risks to the body. How does rosemary interact with medications? Rosemary is not just a fragrant spice, but also a powerful natural remedy that can have a profound effect on the body. For this reason, combining it with medications requires special attention. In some cases, rosemary can enhance the effects of certain drugs, leading to undesirable outcomes. Blood-thinning medications. Rosemary has a mild anticoagulant effect, which by itself is not dangerous. However, if a person is taking blood-thinning medications such as warfarin or heparin, combining them with rosemary can intensify their effect and increase the risk of bleeding. Antihypertensive medications. For those taking medication for high blood pressure, caution is advised when using rosemary. It can enhance the effect of antihypertensive drugs like enalapril, lisinopril, and losartan, which could cause a sharp drop in blood pressure. This may lead to dizziness, weakness, and even fainting. Diuretics. Medications used for treating hypertension, heart disease, and kidney disease work by removing excess fluid from the body. Since rosemary also has a mild diuretic effect, it could interfere with these medications, altering the body's fluid and electrolyte balance. This combination could result in dehydration or disturbances in mineral metabolism. Diabetes medications. Rosemary can lower blood sugar levels, which may pose a risk when taken alongside insulin or metformin. If the effects of these medications are enhanced, blood glucose levels could drop too low, causing weakness, dizziness, and even hypoglycemia. Be cautious. If you are already taking medications as part of your treatment, it is essential to consult with your doctor before incorporating rosemary into your diet. Even natural remedies can have a significant impact on the body, especially when combined with medications. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.